Week 2, Part 3, focusing on health teaching. Health teaching is a central role for nurses in all settings. The goal is to get patients back home as quick as possible. The patient wants this as well. With these quick stays in the hospital settings, there is an increase in the care provided in the community setting. Due to this, teaching becomes the central role. However, health literacy rate is low and impedes self-care. This affects a person's health and healthcare as a whole, with impacts on costs of the care. Health literacy is defined as the degree to which individuals have the capacity to obtain, process, and understand basic health information needed to make appropriate health decisions and services needed to prevent illness. This is from the U.S. Department of Health and Human Services. Health teaching is providing facts, ideas, and skills that change knowledge, attitudes, values, beliefs, behaviors, and practices of individuals, families, systems, and/or communities. From Roberta Hunt's textbook. There are 3 domains that occur with teaching and learning. All 3 domains must be considered in all aspects of teaching and learning process. It is important to assess the client's need, readiness, past experience in the domains. Cognitive is your mental storage, recall of new information and knowledge to problem solve. Here is where critical thinking and knowledge domain occurs. Affective involves feelings, attitudes, values, and emotions that influence learning. The attitude is the domain. Internalization or value for the content is achieved. Psychomotor consists of actual physical skills that can be demonstrated. It is a skill domain. Students demonstrate the appropriate level of the physical skill. And a fourth one that is being considered is the social interaction, where learning for communication and persuasion and influencing others. Here are the principles of learning. With learning, it is important to consider the developmental stage of the client and/or family. Cognitive learning is impacted by the ability to use the information provided to problem solve. It differs for each person. For example, teaching a child about insulin administration versus a young adult learning insulin administration. Affective and psychomotor learning are affected by the developmental stage. The child will learn differently about the insulin than that of the young adult. Past experiences, good or bad, affect this. Remember that the chronological age does not indicate a person's maturity. Parents need to be included when teaching about medication administration or other medical care tasks that need to be done, like dressing changes. Parents may not always understand the instructions provided. Even if the parents have high levels of education, the parents may not always be accurate in providing the medication, performing the dressing change, or administering the tube feeding, or administering the insulin. Adults need to know why they are learning the information many times before this teaching can take place. The rule of thumb is usually 7 times. Never assume that a client have all the ability to understand directions given verbally or written. Illiteracy is found in every walk of life, in all races and cultures, in all socioeconomic levels. Don't assume that all individuals speak or read English even. Never assume the client has the ability to understand verbal direction or read or write. Before teaching can begin, the status of the learner has to be determined. This depends upon their need to learn and their readiness to learn. Need to learn is how the client perceives the information being presented to them. For example, pain control for post-operative surgical patient going home. The need to learn about how to control their pain at home is the priority for the patient. The client has to be ready to learn. Readiness of factors of emotions, skills, and potential impacting the client's readiness. Review the box on page 163 in your textbook, Factors that Affect Readiness to Learn. Motivation is strong determinant in the client's need to know and why this is important to them, to reinforce the drive to learn. This motivation can change daily due to the many different things that affect motivation. Experience can also impact the motivation to learn. What is currently happening that may impact the client's learning? Just being told about a diagnosis of diabetes may not be the time to teach the client about insulin administration. So how do you help? First, material should be at least at a 6th grade level or maybe even lower. Speak directly and simply. Avoid medical jargon. This includes avoiding the medical terminologies or the medical symbols or abbreviations used in written materials. Only cover 2 to 3 points at a time. Read written materials to emphasize key points. Try to include pictures or diagrams. Use graphs and tables instead of using numbers. Also, use a teach-back technique. Try to phrase the questions for a yes or no answer, with the client explaining their medications or show you how the procedure as they might do it at home. Consider non-compliance as a lack of understanding. I want to say that again. Consider non-compliance as a possibility of a lack of understanding. Target the approach based upon what you know about the population. Be proactive. Make sure that there is an interpreter present during the visit. The interpreter, as we'll talk later on, should not be family member or you if you speak that language. It should be someone licensed as an interpreter. Consider that the patient might not be the only one reading the materials. Who else would need to be reading the materials? Parents? A spouse? This is from your book, but it has excellent information. I suggest reviewing this for test information. Here we need to assess the health education needs. Assessment of the audience, health education needs, and learning environment. The target audience may be based on the level of need, available resources, and probability of success. To proceed then to the characteristics of the audience that influence the learning situation. Using the determinants of health in the population health nursing model helps with the accuracy of the assessment, and its relevance to their needs are enhanced. For a biological, influence learning needs and learning capabilities, either individuals or population groups. They learn effectively depends upon the level of maturity, physical and psychological, that has been reached. Beginning age or later end also affect the client's need for education. The physiological function may reveal special needs for health education or impediments. Inadequate physiological function can also give rise to the impediments in learning. Pain may also impede learning. Psychological influences the willingness and ability to learn. Attitudes towards health and health behaviors can enhance or detract from the motivation. Stress and anxiety impede learning. Environmental effects on the learning. Adequate lighting, too much noise, any other distractions. Environmental factors may show the need for health education. Air pollution and those with chronic respiratory conditions may also impact it. Social cultural influence is shaping the attitudes about health and health-related behaviors. What is the exposure to health-related information or their health literacy? Is their cultural influence with communication styles? What is their concept of time, personal space, values, and perceptions of environmental control? The client role and the life expectations are also included. Roles may influence one's ability to attend to health messages. Effectiveness of health education in terms of trust placed on the health professional. Language impedes learning. Non-English speakers are less likely to have a regular source of health care and receive preventative care and at a higher risk for medical error. Occupation can give rise to health needs as well. The behavior influence is the need for health education in diet, exercise, smoking, sexual activity. Health system then is the preventative therapeutic recommendations and the elements of healthcare regimen. Here we must learn to plan and prioritize their learning needs by developing goals and objectives, selecting the content and teaching strategies, and then using the media in the health education and health promotion.